Hi, my name is William Carlson-Jones and I'm a current final year student in the Bachelor of Oral Health program at the University of Adelaide. So I'm here to talk to you about the flipped classroom approach. I've been learning in a flipped classroom approach since first year, and I found it to be a great way of learning key concepts with a greater focus on face-to-face learning. And I put together a small presentation from a student's perspective on the learning style, and I hope you enjoy it. Thanks. So just a bit about the oral health program here at Adelaide Uni. When you complete successful completion of the oral health program qualifies you as an oral health therapist. So an oral health therapist is a duly qualified dental professional in dental therapy and dental hygiene. So oral health therapists in the dental setting provide a wide range of dental care in a variety of settings to children, adolescents and adults. The oral health therapist works as part of a team alongside dentists, dental assistants to provide a more holistic care to patients. So as I mentioned in the introduction, I've been learning in a flipped classroom approach for some of my lectures in the oral health program. So basically, what is it? So a flipped classroom approach is a pedagogical model in which the typical lecture and homework elements of a course are reversed. So in the traditional model, where there was a lecture, about an hour or so dedicated to lecture time during class, where the information was presented and then the student was required to go home and do the homework activities at home. Whereas the flipped classroom approach focuses on delivering the information in an online format, and the hour that is dedicated for face-to-face learning builds upon knowledge with classroom activities. So the lecture is all about that knowledge acquisition and sort of taking in new information, whereas the tutorial and the classroom activity is all about building on that knowledge and that knowledge construction. So the flipped classroom, the key point with that is that it devotes class time to application of concepts that give instructors a better opportunity to detect errors in students' thinking, and it puts more of the responsibility for learning on the shoulders of students while giving them a greater impetus to experiment. So the flipped classroom approach that the oral health program takes is run using what we like to call ILMs, or interactive online learning modules. So they run in a structured format in an online presentation available through MyUni. So the information is presented through a module with applied questions in a checkpoint format throughout the module. So the most recent topic that we were taught in was managing pain in children and adolescents. So we're able to, as students, to progress back and forth throughout the module at our own pace, pausing and rewinding where required for concepts that we're finding it a little bit difficult to understand at first. So this is a screen capture from the most recent interactive learning module that we had. So just on the left you can see the checkpoints and the topics listed. So in grey is ones that have already been viewed, and the black are to be viewed. So we've got the navigation buttons just to the bottom right, so being able to navigate forward and back, and the audio is then played over whilst undertaking the module. So how it all worked in the oral health program is, at the beginning of the module, the learning outcomes are identified at the beginning, just to make us aware of what we should be taking from the module and what's expected from us. So throughout the sequential checkpoint approach, there's the questions that are outlined in a sort of SurveyMonkey multiple choice format, and from that we're able to respond to the questions of what we see fit as the best answer, and this sends a feedback report to the tutors and the lecturers just to sort of see how the students are answering and any confusion that they may have in the questions, and that there can be a focus for the session in the face-to-face to help build upon and make sure everyone's on the same page with general topics. So what happens during class? So instead of a lecture, we're presented with case studies, and from what we've taken from our modules, we're then expected to provide a treatment plan and discuss the rationale behind our decisions. So, for example, certain symptoms and clinical signs from a patient, be it in photographs or a medical history or dental history, we're able to determine what parts of those information is important in helping us to decide how we would approach the situation in a clinical environment. So just to recap, this is like a flow diagram model of a flipped classroom. So we start off with the concept exploration that's presented in the interactive learning modules. So So that's where we have the video and the audio recordings, that we have external references to readings and articles. Then we go on to the meaning making. So from that, we can then refer to online discussions, the interactive questions in the SurveyMonkey format. We're able to communicate student to student on online discussions, Facebook, and then from there we then meet face-to-face in the demonstration and application phase. So within that, we then have the clinical case studies presented to us in the face-to-face learning environment, and we're able to, as students, present the treatment plan that we've rationalised and discuss what has been the basis for the decisions and what the appropriate treatment would then be. So what are the benefits of a flipped classroom approach for a student? So from my perspective, the benefits that I've found is that there's a longer time spent with the students with an emphasised focus on learning and helping understand key concepts. So there's that longer face-to-face time with the tutor to the student, and I think that's really important in helping to really understand the topics that you might be struggling with. It's very efficient, so the prior work is done before, so any misunderstood concepts that the cohort may have can be highlighted as a focus for the session. It encourages active discussions between the colleagues, and it initiates a more investigative approach to learning, whereby the students are able to research the topics further and report back additional findings in class. So summarising that all, there's really that greater focus on concept exploration, meaning making and demonstration or application of knowledge in the face-to-face setting. So just building upon the last slide that we had, the face-to-face learning creates a nurturing environment for us to help build upon any misunderstandings and help to ingrain a better understanding of key topics. So just looking at the right-hand side picture there, in our oral health lectures, we would often get out sheets of butcher's paper and we'd work together as groups devising a treatment plan for things like periopathogenesis and the diagnosis, and then we'd then convene back together as a class and discuss and present these. So just concluding the presentation here today from a student's perspective, I believe the flipped classroom approach is a great model to use in combination with previously existing models of teaching within, be it a tertiary or a high school course. It encourages a greater participation by students and is more flexible around other commitments. It definitely increases overall cohesion of the student group, mirroring professional discussions graduates may have within their future workplaces, be that in discussing a patient's treatment, getting a second opinion. It really helps to set up graduates of real-life communications settings. I'd just like to thank you all for listening, and as you can see, a lot of us students are very much over the lectures, so hopefully incorporating more of the online learning and interactive learning modules can help prevent these sort of situations from happening in class.